Namaste. Welcome you all for the yoga session. In this we are going to use a chair, a mat and a couple of blankets. In this session we are going to work on some of the important trunk and hip movements with the help of a chair. We shall start with a few postures for the core muscles. Lay on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back. That should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Now relax both the arms. Keep them by the side of the trunk, palm facing down. As we inhale, rise both arms up over the head. Then as we exhale, bring it back. Match the action of the breathing. Feel the weight of the arms as you move them up and down. Inhale up. At the end of the inhalation, it should have reached the ground again over the head. Then as you exhale, bring it back, taking the palm to the sides of the and at the end of the exhalation, the palm should land on the mat. Match your breathing and the action. This is good for the scapular region, the shoulder joint and the arms. A good way to also improve the depth of inhalation and exhalation. Also feel the position of the arms, especially when you close the eyes. You must feel from within the position of the arms as they move up and down. That is, our ability of proprioception improves if we are able to move them as synchronously as possible. As you inhale, you must lift the arms and also ensure that as you inhale, the abdominal cavity expands. Then as you exhale, contract the abdominal muscles and also move the arms. Watch the shoulder joints. Watch the scapular region. Watch the chest. chin towards the chest. Feel your arms. Feel the weight of the arms as you move them up and down. Now relax the arms. You can fold the elbows, resting the palms on the abdomen and chest. Rise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch at the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very attentively be done. Left leg down. Relax your breathing, watch your back, rise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest but ensure that the hip, knee and ankle, they're all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles a little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh from left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible, then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull powerfully and then push across the chest. Feel the stretch in the gluteal region, especially the gluteal maximus muscle gets a good stretch in this posture. Breathe well. Be aware of your breath. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. The gluteal maximus muscle is one of the major muscles of our body, so this posture gives a good and intense stretch for the gluteal maximus muscles. You have to push the knee across the chest so that you get a more penetrating stretch. Release left leg. One more time. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the complete hip musculature. Feel the muscles of the lower back. To feel the muscles of the lower back or the posterior surface, you should use your breathing to sensitize that region. Release right leg, left leg. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. So this posture is also one of the very important postures for the health of the back. Release left leg. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side. Sit upright on the chair, chest and navel up. Palm should face upwards. Sit to your right side, chest and navel up. Hold the top of the chair, inhale, exhale, turn. Twist the trunk. Grip the chair properly and turn. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Turn the neck also in the direction of the twist. Watch your breathing. Slowly inhale, slowly exhale. Both shoulders should be even, elbows closer. Slowly come up. Change side. Sit to your left side. Hold the top of the chair, inhale, exhale, turn. Rest the foot properly. Twisting postures help to relieve the stiffness in the back. They also invigorate the intestinal muscles and the organs. They help the paraspinal muscles. They also help the oblique muscles in the abdomen. Slowly come up. One more time. Sit your right side. Inhale, exhale, turn. Twist the trunk, chest and navel up. With every exhalation, try to twist more. As you may notice, the cervical region twists the most, followed by the thoracic and then the lumbar. Slowly come up, chain. Sit your left side. Press the foot properly. Hold the top of the chair. Inhale, exhale, turn. Keep the elbows closer. Shoulder girdle parallel to the ground. Turn the neck also in the direction of the twist. As we inhale, the abdominal cavity should expand. As we exhale, it should contract. Slowly come up. Sit upright. Stand up. Keep the chair to your front. Stand about 2 feet away from the chair. Join the heel. Rise your right leg up, rest on the seat of the chair, right knee flexed, bend, hold the top of the chair, stretch the heel, push the heel down and pull it closer to you without allowing it to slide. Feel the hamstrings, the back of the thigh, chest and navel up. Keeping the knee flexed, pushing the heel down and pulling it towards you would engage the hamstrings. Then slowly straighten right leg. Keep on pulling the kneecap, chest and navel up. Feel the hamstring muscles. You have to push the root of the right thigh down, lift the trunk and navel up to intensify the stretch at the back of the right thigh. Slowly come up, right leg down, chain, left leg up, left heel on the seat of the chair, hold the top of the chair from both hands, flex the left knee, push the heel down and pull it towards you without allowing the heel to slide, and engage the hamstrings. Chest and navel up. Then gradually, slowly stretch left leg. Extend the left knee completely. Pull the kneecap, toes towards the knee, kneecap towards the hip. Push the root of the left thigh, lift the trunk and navel up. A good hip flexion movement. Slowly come up, take your left leg down, stand in Tadasana. Foot 6 inches apart, stand a little closer to the chair. Inhale, exhale, flex the hip, taking the trunk forward, rest the forehead on the seat of the chair, stretch both arms. If you cannot rest the forehead on the seat of the chair, you can keep some blankets so that the height is increased, but ensure that the trunk is not flexed. The flexion is from the hip. You have to keep the spinal column as it is. Do not compromise with the integrity of the spinal column. Keep on pulling the kneecap, foot 6 inches apart, foot running parallel to one another. Activate the gluteal muscles and the hamstrings. Breathe well. As we inhale, abdominal cavity should expand. As we exhale, it should contract. This is also good for the trunk and the abdomen. Slowly come up. Stand upright. Stand in Tadasana. Now rise your right hand up. Inhale, stretch the right hand along with the trunk. Exhale, bend onto your left side. Do not sway the hips sideways. Right hand absolutely straight. Bend to your left side. Arms and trunk should be in the same plane. Sideward bending. So we've been looking at the twisting of the trunk, the forward bending of the trunk, now the sideward bending. So these are all some of the major movements of the trunk. Both legs straight. Watch the pressure distribution on the foot. Inhale, with the stretch come up. Exhale, right hand down. Left hand up. As you inhale, stretch the left hand along with the lateral muscles. Exhale, bend to your right side. When you bend, do not push the hip sideways. As you inhale and exhale, feel the portion of the abdomen that is subjected to a good stretch. Create more space, create more freedom. Keep the tongue relaxed. Keeping the left hand straight, slowly come up. As we exhale, bring the left hand down. Chest and navel up. Now keep both the palm on the waistline, thumb towards the spine. Foot parallel, foot 6 inches apart, chest and navel up, elbows closer. Inhale, look up, exhale, bend back. Keep the legs straight. Bend the trunk. This is a good hyperextension for the spinal column. Spinal column is a very mobile but yet stable system. Feel the stretch in the pelvis, abdomen and chest. Hyperextend even the cervical spine, the neck, look up. Do not hold the breath. Breathe well. Slowly come up as you inhale, then exhale, relax the arms. Stand in third asana in front of the chair. Now these four trunk movements we shall see with hip flexion. Right leg up, stretch the right leg, pull the kneecap, stretch the toes, then slowly bend forward. So we are trying hip flexion with forward bending. We can flex the elbows, bend forward. Both legs straight. Push the root of the right thigh down and bend forward. Slowly come up, right leg down, chain, left leg up, left heel on the seat of the chair, left leg straight, lean forward, hold the top of the chair, both legs straight, inhale, exhale, bend forward. Bend the trunk as much as possible. Both legs straight. Note the orientation of the right foot. Right foot in line with the chair. Left leg straight. Watch your breathing. Slowly come up, bring your left leg down, stand in Tadasana. So in this we have combined the hip flexion with the trunk forward bend. Now right leg up again, pull the kneecap, right heel on the seat of the chair, right leg straight, chest and navel up, stand upright. Rise your right hand up, inhale, stretch the right hand, exhale, bend onto your left side. Do not push the hip to the side, both legs straight. So trunk sideward bend with hip flexion. Be strong on both the legs, bend to the side, keep the right hand absolutely straight, stretch well. As we inhale, come up, exhale, right hand down. Right leg also down, chain. Left leg up, left heel on the seat of the chair, pull the kneecap, stretch the heel, push the root of the left thigh down, stretch your left hand up, inhale, stretch, exhale, bend onto the right side. Keep on pulling the kneecap, be strong on both the legs, push the root of the left thigh down. As we inhale, abdominal cavity should expand, as we exhale it should contract. Use the arms of the forearm and upper arm also to stretch well. Inhale, come up, exhale, left hand down, take your left leg also down, Tadasana, Right leg up. Heel on the seat of the chair. Pull the kneecap, chest and navel up. Left hand up. Inhale, stretch the left hand. Exhale, bend onto the right side. Note the change in the direction of sideward bend. Stretch well. We are combining the various trunk movements with hip flexion. Inhale, come up with the stretch. Exhale, left hand down. Right leg also down. Third asana. Chain. Left leg up. Left heel on the seat of the chair. Pull the kneecap. Push the root of the left thigh down. Right hand up. Inhale, stretch the trunk along with the right arm. Exhale, bend to your left side. Be strong on both the legs. Note the orientations properly. Understand the alignment. Combining various trunk movements with hip flexion engages the host of muscles in the lumbopelvic hip complex. Inhale, come up. Exhale, right hand down. Left leg also down. Third asana. Watch your breathing. Right leg up. Heel on the seat of the chair. Pull the kneecap. Push the root of the right thigh down. Both legs straight. Both hand on the waistline. Thumb towards the spine. Inhale, exhale. Twist the trunk. Bend. Keep the left hand fingertips on the seat of the chair. Right hand on the waistline. Twist the trunk. Look up. Turn the cervical spine and look up. You should keep the left hand fingertips onto the right side of the right heel. Twist well. Push the root of the right thigh down. Pull the kneecap. Be strong on both the legs. Twist the trunk. Inhale, come up. Bring the right leg down. Chain, left leg up. Pull the kneecap, chest and navel up. Be strong on both the legs. Watch their orientation. Inhale, exhale, twist the trunk. Take your right hand fingertips, press it on the chair in front of the left ankle and turn. Twist the trunk. Turn the neck also and look up. Breathe well. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Be aware of what you are doing. You should be present. You should be pleasant. Get involved in the posture. Stretch the spine, twist the spine. Push the root of the left thigh down. Inhale, come up. Exhale, left leg down. Third asana. Right leg up. Pull the kneecap, stretch the heel. Both hand on the waistline, thumb towards the spine. elbows closer, chest and navel up. Inhale, look up. Exhale, bend back. Slowly, gently bend back. Both legs straight. Do not hold the breath. Feel the pelvis, feel the hip, feel the abdomen and chest. Slowly come up. Right leg down. Change. Left leg up. Pull the kneecap, stretch the heel. Inhale, look up, exhale, bend back, elbows closer to the trunk. All these postures where we have superimposed trunk movements on the hip flexion also have a good impact on improving balance and stability of our system. Do not hold the breath. Slowly come up, take your left leg down, Tadasana. Both hands on the waistline, inhale, exhale, bend back. Extension of the spinal column. Feel the stretch in the pelvis, abdomen and the chest, elbows closer to the trunk. Do not hold the breath. Slowly come up. Sit in Virasana on a blanket. Blanket below the hip, legs folded sideways. Sit upright, both palm facing upwards, tip of the thumb and index finger in contact. Virasana helps to remove the fatigue in the lower extremities. Thigh and legs greatly get relaxed. Watch your breathing. So chair greatly helps in superimposing these postures very effectively. It also helps us to find a good orientation and alignment, gives us good support. One can stay for a longer time with the help of the chair. And these combination of postures greatly help us in rejuvenating not only the muscles but also the neuromuscular control. Slowly get up. Stand upright in Tadasana, chair to your right side. Stand in Tadasana, chest and navel up. Rise your right leg up, Rest the heel on the seat of the chair, knees slightly bent, push the heel down and pull it towards you without allowing the heel to slide, so that you engage the right hamstring muscles, chest and navel up. The hip abduction, sideward movement. Now slowly straighten the right leg, stretch the heel, toes towards the knee, kneecap towards the hip, push it down, chest and navel up. Note the orientation of the legs. Both legs straight. Slowly bring right leg down, Tadasana. Turn to the other side. Left leg up. Left knee slightly bent to begin with. Do not allow the pelvis to rotate. Keep the pelvis in balance. Left knee slightly bent. Push the heel and pull the heel towards you. Engage the left hamstrings. Then gently extend the left knee, left leg straight. Push the root of the left thigh down, chest and navel up. This is a good sideward movement of the hip. Left foot to center the right foot. Hip is one of the major joints. Slowly take your left leg down, Tadasana, chest and navel up. Turn to front. Stand upright. We shall now try some trunk movements with this base posture. The sideward hip stretch. Right leg up. Pull the kneecap. Stretch the heel. Chest and navel up. Both legs straight. Push the root of the right thigh down. Both hands on the waistline. Keep on pulling the kneecap. Stretch the spine and slowly bend the trunk forward. Be strong on both the legs. Bend forward. Keep both hands down on the floor and bend the trunk. Stretch the spine. Be strong on both the legs. Pull the kneecap. You can keep the fingertips on the floor. You can also flex the arms. Stretch the trunk as much as possible. Now slowly come up, both hands on the waistline. Right leg down. Tadasana. Hip is a very strong ball and socket type of joint. Turn to other side, then chain. Left leg up. Pull the kneecap, stretch the heel. Both hands on the waistline. Chest and navel up. Note the orientation of the right foot. Inhale, exhale. Bend the trunk. And then take both hands down, keep the fingertips, stretch the spine, breathe well. Stretch the left heel, push the root of the left thigh down. Watch the hip, watch the lumbar region, watch the thigh. Slowly come up. Take your left leg down, Tadasana. Turn to the front. Stand upright. Right leg up, onto the chair, chest and navel up. Watch the position of the legs, foot. Raise your left hand up. Inhale, stretch the arm along with the trunk muscles. Exhale, bend onto the right side. Slide your right palm on the leg. Breathe well. Bending should be in the same plane. The legs, arms and trunk should be in the same plane perpendicular to the floor. Breathe well. Push the root of the right thigh down. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Feel the complete abdominal cavity as you inhale, exhale. Now inhale, come up, exhale, right hand down. Take your right leg down. Turn to the other side. Tadasana. Chest and navel up. Left leg up. Stretch the heel, toes towards the knee, pull the kneecap, left hand on the thigh, right hand on the waistline. Right hand up. Inhale, stretch the right hand, exhale, bend on to the left side. Keep on stretching the right hand. The muscles of the arms also you should get involved. Don't let them loose. Stretch well. Watch your breathing. Be present. Have complete postural awareness. You should meditate on the posture, meditate on the breathing. As you inhale, come up, exhale, right hand down. Tadasana. Turn to the front. Chest and navel up. Hip is also one of the most mobile joints. Right leg up. Right heel on the seat of the chair. Be strong on both the legs, chest and navel up. Now rise your right hand up. Inhale, stretch, exhale, bend to the left side. Note the change in the direction of the bending. But even when you bend to the left side, ensure to push the root of the right thigh down so that you can feel the stretch in the trunk, especially the right side, better. Use the breath also to enhance the feel for the stretch. Keep on pulling the kneecap. Inhale, come up, exhale, right hand down. Right leg down, Tadasana. Turn to the other side. Chest and navel up. Left leg up. Stretch the heel, pull the kneecap, push the root of the left thigh. Raise your left hand up. Inhale, stretch, exhale, bend onto the right side. Push the root of the left thigh down. Do not change the orientation of the left foot. Heel towards the knee, kneecap towards the hip. Breathe well. We are combining the movement of the hip with the movements of the trunk. So these movements also help the joints of the lower extremities. Inhale, come up. Exhale, left hand down. Turn to the side. Stand in Virasana. Rise your right leg up, stretch the heel, pull the kneecap, chest and navel up. Both hands on the waistline. Inhale, look up, exhale, bend back. Extension of the spinal column. Bend the neck also. But be strong on both the legs. Do not hold the breath. As you inhale, abdomen should expand. As you exhale, it should contract. Inhale, come up. Exhale. Take your right leg down, Virasana. Turn to the other side. Chain. Left leg up, stretch the heel, pull the kneecap. Both hands on the waistline. Elbows closer. Inhale, look up, exhale, bend back. Feel the abdomen. Feel the pelvis. Feel the chest. A good stretch for the organs in the pelvis, abdomen, chest. And be aware of the positioning of both the legs. A good stretch even for the neck muscles, the heart, lung, the liver, spleen, pancreas, the urinary bladder, all these vital areas get a good stretch. Inhale, come up. Left leg down, Virasana. Turn to the front. Chest and navel up. Right leg up. Pull the kneecap. Push the root of the right thigh down. Both hands on the waistline. Inhale, exhale. Twist the trunk. Bend. Take your left hand fingertips onto the chair by the side of the right heel. Right hand on the waistline. Turn. Turn the right shoulder as much as possible. Slowly come up. Right leg down. Virasana. Change side. Left leg up. Pull the kneecap. Push the root of the left thigh down. Both hands on the waistline. Note the position of the right foot. Inhale, exhale. Twist and bend. Take the right hand fingertips. Rest it on the seat of the chair in front of the ankle. Left hand on the waistline. Twist the trunk. You have to stretch the trunk and twist the trunk. Feel the gluteal region. Feel the lumbar region and the abdominal cavity. Breathe well. So these combination of movements does help the host of muscles in the lumbopelvic hip complex. Slowly come up. Left leg down, Virasana. So these movements engage the kinematic chain, that is the linking mechanism between muscle to muscle. Sit on a blanket, sit upright in Vajrasana. Join the heel, join the big toe, sit on the heel. Sit upright. Palm should face upwards, tip of the thumb and index finger in contact. Eyes gently closed. Breathing relaxed. Just watch your breathing, slow inhalation, slow exhalation. So in this session, we have worked on two important movements of the hip in combination with some of the major movements of the trunk like forward bending, sideward bending, backward bending and twisting. In doing this, there is also an element of balance and stability which would also help in gaining better neuromuscular control. And all these postures have to be practiced with total involvement. Mind should be with the posture and with the breath. Then the posture becomes meditative. That kind of a practice helps us to get holistic development, physical, physiological, neurological and psychological. Namaste.